Dr. Melendez and Licet Valois discussed the importance of teaching brain health from an early age so we can build healthy habits that last a lifetime. Let's learn how to set up the next generation for success.
I just think that the implications of caring for our brain go beyond who we are into society, but how do we get ourselves to take care of our brain internally? What is depriving us, or what is stopping us from being more proactive for taking care of our brain when we know that there are conditions like dementia? That's one of the major fears nowadays in society, though.
Yeah, I think there are probably many reasons for that, Lisette, from cultural, religious, socioeconomic, um, marketing. So when it comes to actually see the need to take care of your health, you're facing perhaps some internal demons. You also may have subjective biases from previous negative experience. I mean, if you want to actually have any chance to succeed, it's about empowering people. Empowering people to take care of themselves. It's about reinforcing, giving positive feedback about every single small step that they are making in the right direction. It's about those individuals feeling supported by a group, a group of peers. And that was something that we saw in the Finger study. The Finger study, which is the first randomized controlled trial on how multi-domain interventions in lifestyle factors can improve brain health and can reduce the chance of cognitive impairment. What made that study successful was the fact that those participants who were in the treatment group, they felt part of the group. They felt that they had some control about their decisions and about their health. So there has been, they said, some projects. There was a project led in Manhattan, Harlem. A group of doctors from Mount Sinai Hospital did a school-based intervention program looking at reducing the risk of vascular disease by educating children on healthy lifestyle habits. But they went beyond the fact of just telling them what is healthy habit. They also educated their parents. They also educated their educators and teachers. So reach you have to reach beyond the actual individual. They also look into something that I found very important. They educated those children about how to control their emotions, how to regulate their emotions and control their actions in a way that those children will develop more brain resilience. Neurological disorders are on the increase. We are now 25% of the population has either a mental health disorder or a neurological disorder. That has made some countries in Europe to adopt measures by implementing national brain plans, expanding, investing in research about brain health and prevention of brain disorders, and supporting patients and families with brain disorders. Those are the main pillars of those national brain health plans that are already up and running in Germany, Norway, Finland, Poland, and most recently in Switzerland. That gives us an indication of the magnitude of the problem and the need to take action about this. The ramifications of having a good brain health is benefit the whole community, they said. But yeah, the actual either motivators to change or the barriers to change is something that you have to just address at very early stage in a person's life, but involving people who may have some form of moral influence on that particular individual. I always say it's hard to stop smoking if you are surrounded by a group of friends who all of them smoke. It's going to be harder. While if you decide to give up smoking, but one of your friends is also trying to do it at the same time than you, that may be easier for both of you to achieve that objective.
And you actually touch in a lot of good points, Dr. Melendez, and hopefully I'm going to be able to follow up because there are some things that really spark my thinking as I heard you talking before. This part of the education, that's definitely for sure. We have to make sure that we educate our communities about, just like you said, the ramifications, the impact of brain health care. And there's not necessarily a point that we have to wait for a crisis to happen. I don't think it's necessary for us to wait until someone has been diagnosed or started exhibiting the symptomatology of some type of dementia to start getting more involved and wanting to learn about brain health. I think just like you say in the families, since an early age, we have to make sure that we educate our children, kids in schools, to understand how important it is to take care of our brain. And if we do it in a way that is like a family oriented type of thing, that we don't just educate because grandma or grandpa is behaving in a different way. Let's learn about it, and that part about prevention. Even if we do not get to prevent a lot of the current medical conditions, neurological conditions that we're dealing with nowadays, it is important that we can start working on delaying the onset. And there's a lot of controversy nowadays with some uh, conditions because people talk about prevention versus delaying. And dementia is one of those as the main threat to our brain. Wouldn't it be easier or wouldn't it be more encouraging for an individual who knows he or she is at risk at developing some type of dementia to be able to start engaging in behaviors to delay the onset? Because I wonder about that. We know that we might be at risk. So, what is stopping us from being more proactive? Instead of, if I know that I can do something to help me, so I can continue enjoying my life, optimizing my living, maximizing my potential. Why do I don't get involved doing things that I know will be helpful to me?
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.